Right now, we have 12 pediatric patients in our children's hospital. 6 of those children are still in critical condition. 6 are in stable condition. We think it is important to point out that we also had 19 patients arrive shortly after the accident. These patients are now what would be typically referred to as the walking wounded, and most of the children suffered bruises and lacerations and were in stable condition when they left the hospital. Some had sore ankles and wrists, but amazingly, our ER team and all those around us were able to treat and release all of them in under 2 hours after they arrived. What made this particular scenario particularly difficult was that these patients are all young children. They had no IDs with them when they arrived. None of the parents were present when they arrived, and they were all wearing uniforms when they arrived. Many of them were scared or too dazed to talk to us, and because of their young age, many of them were unable to spell their names, did not know their birth dates, or even their parents' names. Several said mama when they were asked what their name was. So we had representatives from our child life department take photos of each patient and show it to the teachers from Woodmore Elementary School to give us a better idea of who was who. This process took a while, but was necessary in order to reunite each child with his or her parents when they arrived at Children's.
Since parents of all the children who rode this school bus were instructed to come to Children's Hospital, we also had that responsibility to notify those whose children had died in the bus crash. Fortunately, our staff was accompanied by members of the Chattanooga Police Department, the school principal, other school officials, chaplains, our executive nursing officer. At one point, we think we had 800 family members in our hospital.